Problems with memory loss, thinking, and behavior are not always a normal part of aging. Symptoms can, of course, develop over time and then even worsen. Alzheimer's is a type of dementia that needs to be addressed as soon as possible. And joining me now is Dr. Marshall Nash with neurostudies.net. Dr. Nash, thank you for coming in.
Thank you for having me.
Okay, something that a lot of people hear about, you hear about Alzheimer's, but what is it exactly?
Alzheimer's is a degenerative disease of the brain that usually starts around age 50 and causes loss of memory and also impairment in people's executive and cognitive function, their ability to multitask.
And then, of course, science has come such a long way. There are lots of new developments. So what of those have you been working with?
Well, the science behind the study of Alzheimer's disease has really grown, and it's pretty amazing, interesting stuff right now. We have PET scans that can detect the plaques and tangles of Alzheimer's, so you no longer need to have a brain biopsy done. You can actually detect pathology from Alzheimer's disease 20 years before you even have symptoms now.
And then you have clinical trials, and this is something that helps people pretty much from step one all the way through. So tell me a little bit about what you offer.
Well, clinical research trials are the way that we prove in medicine that something actually works and is safe and effective. So what we do is we take a group of people with the potential to develop Alzheimer's disease, and we might do a blood test because there are genetic predispositions to developing Alzheimer's disease. And if you have those, we can give you medicines in a different way than what's out on the market right now. There are medicines that work differently. There are medicines that are trying to prevent Alzheimer's disease. And these are real research studies, so we have to compare groups of people taking the medicine versus people not taking the medicine to see if we can get an effect, to see if we can get improvement in their memory and their executive function.
Now, this is something that typically would affect someone a little bit older in life. What are the signs that should lead them to you? You know, should they come in immediately? When should they know, okay, I need to actually take the step into finding out what's going on with me?
Well, Alzheimer's and dementia is a pervasive problem, so almost everyone has some connection with a person with dementia or Alzheimer's disease. So that's usually the trigger for people to come in and get checked. But checking their mental health and checking their memory should be a routine part of their evaluation, just like a colonoscopy or just like a routine physical checkup. 30% of people by age 70 have some degree of memory loss, and most of them don't know it until they're actually tested for it.
And then when it comes to knowing about it, of course, you want to learn as early as possible, but there are probably things that we can do lifestyle-wise, whether it's a change, something we can implement into our lives that can help slow it down.
Well, good health and nutrition and mental health, sharpening your mind, is always a part of our clinical trials. So what we're doing when we have studies is we're comparing people who lead a good healthy lifestyle to people with a good healthy lifestyle plus a medication usually. And we can actually show a difference in people between those two groups, because nutrition and exercise is important, but it's also linked to diabetes, to hypertension, to cholesterol, and improving your lifestyle is going to improve those and improve your general health.
And let's talk about your facility. You know, it's not the typical doctor's office that you come into, so what can patients expect?
Well, we have, it is a regular neurology practice, but we really specialize in clinical research trials. So when people come to our office, the first thing they're going to be given is a consent form to read. We give it to them in the waiting room so they have plenty of time to read it, and they come back and ask questions about that. That's the main difference between that and a regular medical practice, is there's a lot of emphasis on understanding the disease process, understanding the study that they're participating in. And then we have specialized testing. There are lots of nurses and clinicians that do cognitive testing. We do blood testing, and we have access to specialized imaging technologies like PET scans that we were talking about to detect the plaques and tangles of Alzheimer's disease, MRI scans, and so forth.
All right, and of course, you guys make it easy for everybody to be able to come to you, to contact you, and to even get a little bit more information. Dr. Nash, thank you very much. Now, of course, for all that extra information, you can log on. You can see it right there on your screen. It's alzheimersatlanta.com. You can also call them. Numbers 404-475-0552.